So we want to be able to sort of mush the food in between our fingers. Like the avocado, I find sometimes, I don't know if it's like the texture or the taste or whatever it is, but it does cause babies to gag a lot. In like the third trimester of pregnancy, babies' iron stores are sort of built up, and that typically lasts until they're about 6 months. Just let them get messy, let them enjoy their mealtime. The more messier, the better. They're exploring, they're playing, they're interacting.
So let's do a little bit of myth busting. Starting solids will help my baby sleep through the night.
Myth.
Starting solids is one of those milestones that looks really adorable online, but in real life, it can be really confusing, messy, and overwhelming. 1 second, your baby is happily eating some vegetable mash. The next, it's in your hair and on the ceiling. Turning the chaos into confidence and starting solids safely can sometimes feel impossible. But we've asked Annabel Davies, a dietitian at the Sydney Children's Hospitals Network, to share her knowledge and help get your bub eating happily. Annabel, hi, welcome to the podcast.
Hi, thank you for having me.
Thanks for coming, appreciate it. So before we jump into the myths and the facts, tell us a little about yourself and what you do here at the network.
Well, I've been working at Sydney Kids now for like 3.5 years. I started working here basically as a new grad, and I think throughout uni I knew I always wanted to work in peds. Initially it started, I was doing like a health promotion project on childhood obesity actually, and I think what drew me to pediatrics was learning about family dynamics. So in peds, it's not just about like the patient, it's about the family or the parents as well. And I just thought that was really interesting. And I was lucky enough to have my placement here as a student, just fell in love with it. But it's all just so interesting. And I just love working here. So
That's wonderful. It makes a difference when you love what you do.
Yeah.
So let's just jump into the very, very beginning. When should babies start solids?
So our national guidelines say sort of around 6 months and not before 4 months. But the things that we really want to be looking out for are the signs of readiness. So the main one being, head and neck control. If a baby doesn't have adequate head and neck control, how are they going to start solids essentially? And this can develop at all different sort of stages between that sort of 4 to 6 month mark. All babies are different. And I think it's just really important to watch them and their signs of readiness as opposed to like the calendar. As soon as a baby is 5 months doesn't mean that they're like ready to start solids. Some other signs for readiness would be, are they able to sit kind of upright in a supported chair? We're not expecting them to sit like upright independently, but in a high chair, are they able to sit up, feed safely essentially? We don't want them sort of falling forward onto the high chair because that's just not going to be a successful time with solids. And, are they interested in food? So are they watching what their parents are eating? Are they reaching for food? Are they bringing teething toys like to their mouth? These are all sort of signs to look out for, which indicate that they are ready for solids. And it's really just not a rush. We want to be starting when babies are well, when they're happy, when parents are happy, when things are right.
Yeah, absolutely. I think my son was 5 months. We swapped out. He was getting irritated with the bottle because he just couldn't sit still. He loved looking at us and what we were eating.
Yeah.
So we just thought, we cut out breastfeeding because he was formula fed as well and went straight into solids, and it was like the perfect transition. He took to solids right away. It was
nice.
It really helped us because we were constantly worrying about nutrition and what he was getting because he wasn't taking in as much milk at that point. And it's so hard to know like what foods to start with, what nutrients do they need at that stage because they still are on the bottle or the boob. Is there a good food? What's the recommendation for that?
I think initial like first foods should be, well, we're aiming for foods to be like high in iron. And that's because in like the third trimester of pregnancy, babies' iron stores are sort of built up, and that typically lasts until they're about 6 months. And when we look at their recommended dietary intakes, which is what we recommend they're having each day, their iron requirement from like 0 to 6 months is about 0.2 milligrams per day. And that increases to like 11 milligrams per day before that 7 to 12 months. So it's actually a huge increase in their requirement for iron.
That's great. What are some iron-rich foods we can give?
So you can start with like iron fortified cereals. So they're a great source of iron, but also things like meat, poultry, fish, like tofu, legumes, like leafy greens. They're all great sources. There are two kind of groups of iron. So we've got like our heme iron, which is iron that's sort of derived from animal products, and our non-heme iron, which is the iron derived from like plant products. So if we are going for more like the plant options, like the leafy greens, like the tofu, legumes, just pairing it with some vitamin C of some sort. So whether that's a vegetable or a fruit, that can really enhance the absorption of iron as well.
That is very good to know. My son is obsessed with kidney beans.
Yeah.
And he just eats them straight out of the can. So it's good to know. I'll add some of that to it. So there's two different ways to kind of start solids nowadays, baby-led weaning versus puree feeding. What are benefits to both, and what is baby-led weaning?
Baby-led weaning is, I guess, an approach to starting solids where we're encouraging babies to feed themselves as opposed to the more like traditional starting solids or weaning process, which is usually like with purees and with a spoon and spoon feeding the babies. Essentially, for baby-led weaning, parents just need to prepare like soft foods that are cut up in, I guess, like a finger kind of strip shape, which allows babies to hold on to the food and kind of feed themselves. You can also offer things like broccoli, florets and things like that. So just something that they can grab hold onto and bring to their mouth easily. I guess the thing with baby-led weaning and purees is that the goal is the same. So we're still aiming to get our baby from having milk, like predominantly milk, to transitioning to a like normal food diet. It's not go hard or go home kind of situation. Like you don't have to do baby-led weaning or, purees. Like you can do a mixture of both. And if anything, combining the two methods of doing like a bit of a baby-led approach, but also, having purees and things just allows for a lot more flexibility. It tends to make parents a lot more relaxed about the solids and mealtime process. And it also means that you can be really responding to your baby's preferences and their readiness.
Yeah, absolutely. I know Frankie hated the spoon at the beginning. He thought it was a chew toy.
Yeah.
So we couldn't even attempt to give him a spoon because he would just chew on it the entire time and not intake any food whatsoever. Yeah. I guess the fear with baby-led weaning is more risk of choking hazards. And as you were mentioning before, the importance of iron. What's your recommendation in terms of like chewing on a piece of meat? Is it okay if they're not intaking any of the meat themselves, especially if they don't have teeth already by that point?
For choking, there isn't actually any like research that shows baby-led weaning has more of a risk of choking than like traditional spoon feeding and purees. Babies well equipped with like the gag reflex, so that is super protective for them.
Is there any recommendation on how much they should be eating, or is it just go with the flow with babies?
Yes, it's essentially just go with the flow. So the expectation at the start should not be, my baby needs to eat, half a cup by this age, like a full cup by this age. That's not what we recommend. It's purely responsive feeding. A couple of teaspoons at the start is completely appropriate. And it's not even, the main source of nutrition is still breast milk or formula. So, and that continues up until 12 months actually. So initially it's purely just for tastes, for exposure to different like textures and just for fun, honestly. It's like a huge sensory experience for babies.
Lots of mess.
Yeah, lots of mess. We encourage the mess. And just to have a good time. Like what we want to develop is this enjoyment with feeding. We don't want babies to become stressed out. We don't want parents being stressed, trying to force feed, getting the nutrients in. Like it's okay if it's just a couple of teaspoons to begin with.
I guess, we're speaking about a bit before about choking and the fact that, baby-led weaning versus purees is no greater risk really compared to the two. What should a parent do? Is there anything a parent should do to prepare themselves going into the feeding stage?
I think the first thing is like managing expectations. As well as having the setup, we want babies to be in a supported sort of high chair when they're having solids. We want them to be sat upright. Parents should be spending the time with the baby during like a meal time as well. Obviously, we want full eyes on. It needs to be a supervised thing. And prepare food appropriately. Like, don't give your baby small, hard, crunchy bits of food. Like we want them to be, we want to be giving them the best chance. And that would be, preparing food appropriately.
Is there any way we can tell that a food is safe enough for our child to eat, especially at the beginning?
So we want to be able to sort of mush the food in between our fingers. If you can't do that, then it's not okay, especially if it is those round, like small bits of food that can essentially block the baby's airway.
There's so much to learn during that stage.
Yeah.
I know one of the things that freaked me out is the sound of gagging, especially I remember the first time we fed Frankie, it was avocado and he just nonstop gagged because he was like, what on earth is this? And gagging versus choking, it's so scary when you hear any sort of cough when they're starting solids. Can you tell me the difference between the two?
If you see a baby gag, it is very confronting. They have this big, gag, retch. They can go all red in the face. Their eyes can start watering. Like, it's not a nice thing to witness.
It's awful.
And I think, it's, of course, it's a source of anxiety for parents. But it's completely normal. And it's actually like a protective mechanism. So babies have a really, really strong gag reflex. And that is to protect their airway. So if they eat something that goes sort of too far back in their mouth, they will gag and it will propel the food forward, where they can either, continue working on it or they can spit it out. So that's the purpose of a gag, and it is completely normal. And things can really trigger a gag, whether it's the food has just gone a bit too far back. Even tastes and flavors can sometimes, like the avocado, I find sometimes, I don't know if it's like the texture or the taste or whatever it is, but it does cause babies to gag a lot.
Good to know.
Choking is a silent process. So you won't be getting that big gagging, retching, coughing. It's actually, very quiet. And babies will, there's something blocking their airway. So whether that's like a full, like complete blockage or a partial blockage, they're not going to be able to breathe. And rather than going sort of like red, you might actually notice that your baby goes blue because they're just not getting the oxygen.
And what should we do in those sort of situations that our child does start to choke?
Yeah, I think to prepare for these sorts of situations, parents should, touch up on their first aid training and their CPR training. So there are some really great resources and videos on the Sydney Children's Hospital Network website where you can watch, videos on choking and gagging. I just think it's really important to for parents to know that gagging is very normal and choking is very rare. So to prepare for like meal times and to reduce the risk of choking happening, it's just very important to make sure that you have a supportive high chair for your baby to sit in and you're preparing foods that are appropriate that reduce the risk of choking. If a baby is choking, you want to be calling 000.
I know a lot of parents freak out about like, I don't have time to cook, or just like, I don't want to be cooking a meal like separately for my kid. Like, what's your recommendations around meal times and involving, especially in those early months of trying to get them, because there is that recommendation that they should be having less sodium than a standard adult. So, the panic around having to not put seasoning in your foods and all that. What's your recommendation around that?
I think the goal is we want babies to be having family meals. So if you are preparing your dinner, just pulling some of those sort of ingredients or like elements, that's what they'd say in MasterChef, aside, and don't add the salt, don't add the chili to that portion of the meal. What you feed your baby doesn't have to be crazy and like out of the world. We want them to be having what you're having essentially. So if you're having meat and veg, your baby can have meat and veg. There's nothing wrong with that.
Oh, that's amazing. Yeah, we've been trying to do family meal times, and honestly, it's harder to start than I realized. Like getting all of the three of us sitting down at the table and not racing around because dinner time's stressful sometimes. But I noticed a massive difference in Frankie's attention span when we're eating with him.
Yeah.
Versus he'll eat his dinner and then he'll see us eating our dinner and then just want our dinner anyway. So might as well do it all together.
Yeah, exactly. The modelling is really great for them to learn. So,
absolutely. Yeah. So constipation comes up a few times as well. What's normal and what's not?
There's a huge sort of spectrum when it comes to baby poo. So babies who are breastfed, they might have a poo after every single feed. So they might have 8 poos a day. But the other side of the spectrum is that a breastfed baby may only poo once a week. With formula-fed babies, they do tend to poo sort of every 1 to 3 days. I don't know what the difference is between why that happens, but that's just what we tend to see. So I guess, baby poo that's like a puree kind of texture, unformed, like a yellowy, green, mustardy kind of color is normal. Sometimes with breastfed babies, they get a lot of like seed kind of things in the poo as well. And that's just basically like undigested milk fat curds. Again, that's completely normal. If a baby was constipated or showing signs that they're constipated, their poo might look quite like dry and crumbly, and it might be quite hard, like hard pellets. And if that is associated with them being in a lot of pain or a lot of distress around sort of passing a poo, then that's something to be concerned about. You know, initially it might be that they need some just more frequent feeds. It could be a hydration thing. But, you know, if you're finding that this is causing your baby a lot of distress, they're having any like blood in their stools, or they're having any fevers, it's best to go to the GP.
I know when Frankie started solids, he dropped us a little bit with his hydration. So we started him on a few fruits and veg that had higher water intake. And I think we had these pouches, which was pear and prune juice, which was just a lifesaver during those stages. Is that normal?
Yes. Yeah, it's very normal for babies' poos. Definitely the consistency and the pattern to change when babies start solids. You know, they've gone from pretty much an exclusive milk diet to, you know, digesting fibers and proteins and all different things that are not milk. So it's very normal for, poos to change in that stage. And if you're finding that your baby is getting quite constipated following the introduction of solids, it'd be good just to focus on some of those high fiber foods. So your fruits and your veggies like pears and prunes, like you said, are really great in helping soften the poo, which makes it easier for the babies to pass. The next thing is like hydration. So making sure that they are adequately hydrated. So whether they do need to increase their milk feeds or whether you can start offering them some like cooled boiled water at their meal times as well. You know, they're likely not to get that much water from doing that, but over time they will start learning how to drink a little bit more water as well.
But when we start solids, is that when we introduce water as well?
Yeah. So you can introduce water in like a sip cup or even like a little open cup at the same time as the solids. And I guess similar to solids, it's not replacing the hydration that they're getting from their milk. It's purely just learning. Like it's learning a new skill. So again, water might end up on the floor, it might end up all down them, but you know, you're providing them the opportunity to learn how to drink water.
Yeah. Absolutely. And once the baby turns 12 months, that's when water should start coming in as more of a hydration source.
Yeah, definitely.
Cool. Good to know. Now let's talk allergies. It is a huge anxiety factor with a lot of parents, and I know people who have waited in the car park in a hospital when starting their babies on peanut butter or whatever. I even know a dear friend of mine who waited in a hospital waiting room just to be ready because she was panicking about it all. What should a parent do before they start introducing allergens? Is there any things they can do to prepare themselves as well as the baby?
I think they can definitely prepare themselves in looking out for what the signs and symptoms are of an allergic reaction. There's, I guess, two types of reactions. There's the IgE-mediated reactions and the non-IgE mediated reactions. So these IgE-mediated reactions are often very quick to come about. You know, they can start showing signs within like minutes to an hour. And these reactions are the ones that, you know, we get like hives, swelling, itchiness, wheeziness. Like this is the type of reaction that will most likely lead to severe reaction like anaphylaxis. With the non-IgE mediated reactions, these are a bit slower to develop. So we're talking more like hours to days. And they tend to affect like the skin and the digestive system. So diarrhea, vomiting, like mucousy poos, like eczema, rashes, are the sorts of things to look out for those reactions. Askia have great like action plans, so parents can also like, I guess, upskill or educate themselves on what to do if their baby experiences a reaction.
So many parents would be asking, what are the main sorts of allergens to be watching out for?
So there are 9 main allergens. We've got peanuts, tree nuts, we've got cow's milk, egg, soy, fish, shellfish, wheat, and sesame. So these are the 9 allergens. You know, other foods can cause like allergic reactions, but these foods are responsible for like 90% of food allergies. And the way to go about introducing allergens is we really want to start pretty much from the get-go. So particularly with egg and peanuts, you know, research is showing that if you introduce these foods between sort of as early on as you can really, so 6 months when babies start solids, it will reduce their risk of developing allergies to these foods. And that is kind of across the board. We're really aiming for all of those allergens to be introduced before a baby is 12 months to reduce their risk of developing a food allergy. Parents can, you know, introduce an allergen by just adding a small amount to their meal. So if you were introducing like peanuts or peanut butter, you can just add like an eighth of a teaspoon into their meal. See how they go. You know, the next day, if there was no reaction, double that dose. So then do like a quarter of a teaspoon and see how they go. And then the next day do like half a teaspoon. At that point, it's kind of well tolerated. They haven't had a reaction. We just want to then keep that allergen in their diet regularly to keep up the exposure.
Yeah.
So I sort of say like an allergen a week is like okay to focus on, and you only want to be doing one allergen at a time because you want to make sure that, you know, you want to be able to identify what they're having a reaction to if they have a reaction.
I had the recommendation with peanut butter that just to add a little bit of water if you're worried about the consistency.
Yeah.
Just a drop of water just to like make it a little bit smoother.
Yeah. Yep.
That's something you're worried about. I remember the tracking on the fridge just to make sure it was very stressful, but that's good to know that 1 week you can kind of work your way through it. That's really manageable in the grand scheme of things. I know you said 9 allergens, but how common is it really to get an allergy?
So the research shows that about 1 in 10 in Australia have a food allergy, which is actually quite high in the scheme of things. Australia is the allergy capital of the world.
Wow.
We're not sure why that is, whether it's like our environment, our genetics,
Just the way
who
it
knows?
is.
Research is researching that at the moment. No clear sort of reason as to why. But, you know, having an anaphylaxis reaction is not, in the grand scheme of things, not super common. So especially on that first exposure as well. So I think the best thing that parents can do is, you know, relax and just plan that a reaction might happen. So they have a bit of a plan if something does sort of go wrong, but to not worry about it too much.
What are the chances of, like, I guess if you have an allergy or someone in your family allergy that carries on to your child, is that something you should be looking out for?
There is some research that suggests that if you have, like if your parents have an allergy, that you might be at a higher risk of having an allergy, but it shouldn't stop parents from introducing, you know, those other allergens. So if you as a parent had an allergy to peanuts, you know, you might want to seek some advice around introducing the peanuts with your GP, whether you know, your child is referred to like an immunologist and whether that's sort of challenged in a more controlled environment, but it shouldn't stop or delay the process of introducing those other allergens.
Yeah, I mean, I guess as you said earlier, like the sooner you do it, the better it is. Really.
Yeah.
And what's the difference between anaphylactic reaction versus just a general reaction? How should you go about either?
Yeah. So if your baby is having an anaphylaxis reaction, they might get swelling around their face, around their lips, their tongue might start swelling, they might start sounding a bit wheezy and a bit hoarse. For babies, you might notice that they're like drooling and they're unable to like vocalize. Hives, itching, these are all the things to look out for. And if it's happening quite like sudden, so within the sort of minutes to within an hour, you would expect to see these symptoms. If your baby is having an anaphylaxis reaction, the best thing to do is call 000. If they're not having an anaphylaxis reaction, you know, they might have some rash on their skin or they might be getting some mucus in their poos or what it might be. The best thing to do there is just to stop introducing that particular food. Go to your GP and then your GP might be able to prescribe some antihistamines or refer to like an immunologist. So those allergens can be tested in a more controlled or challenged in a more controlled environment.
What's your recommendation around a baby not wearing clothes, like just in a nappy so you can see the marks? I know some of my friends did that, some didn't. Is it safer to have them bare-chested?
I mean, it's an interesting point because you will be able to see those like the early signs of having like the rash develop. But we also want to avoid like rubbing allergens and having too much contact with allergens on the skin, because that can actually then cause like contact reactions, which can increase the risk of having a food allergy. Wow. Yeah, so it's probably best to wear like a bib or a smock or something in the process. You can easily sort of take that off and check to see their skin.
Yeah, it makes sense. There is a lot of mess when it comes to starting solids and just kids eating in general. I guess when you're a parent, you just want to clean up and make sure that everything is tidy so that the end result isn't as chaotic. What should you be doing? Should you be wiping their mouths after every bite? What's the recommendation?
Just let them get messy, you know, let them enjoy their mealtime. The more messier, the better. You know, they're exploring, they're playing, they're interacting. The whole process of starting solids isn't just about the food, you know, it's really like a huge developmental process for babies to just get involved and get messy, experience that sensory sensations, you know. So avoid cleaning, you know, tidying up during the mealtime. If you're sort of wiping your baby's mouth, that is just interrupting the process, you know. Just let them be, let them enjoy it. They'll let you know when they're done, and that's when you can, you know, take them out, clean them down, clean the high chair.
I know Frankie loved eating with his hands, and his hands would be a mess by the end of it, but we actually had a really hard time introducing like not knives and forks, but forks and spoons, because he was just so, like, he loves experiencing like the texture with his hands. Is there a stage where they should be learning to use a fork or a spoon that's healthy for their development, or it's kind of go by child?
Yeah, I think it depends. It's obviously an important skill for babies and children to have and to develop. For babies who are quite independent and don't want to be spoon-fed at all, you can sort of have like a rotation of spoons. So, you know, you can let your baby hold a spoon themselves and they can be doing whatever they want with it, and then you can have a spoon as well, and you can pass, and that's a good transition into them being comfortable with using like some cutlery, and you can do that from early on and see how they take it.
I love that idea. That works really well. So let's do a little bit of myth busting before we end this episode, if that's okay. Starting solids will help my baby sleep through the night.
Myth. Starting solids does not help your baby sleep through the night. And if anything, if you start solids too soon, that can cause your baby to have a bit of tummy upset, you know. Their digestive system is still developing, and introducing things like too early might actually cause them some like distension and some gas, and that can actually keep them up overnight.
Oh God, that's not good. Mess when starting solids is encouraged.
Fact.
Food before 1 is just for fun.
Myth.
You have to start with vegetables before fruit.
Myth.
If they spit it out once, they don't like it.
Myth.
Babies need teeth before starting finger foods.
Myth. Babies do not need teeth before starting finger foods. You know, as long as you're preparing those foods appropriately, they're nice and soft, they can mush them around in their mouth. It's completely fine.
Before we finish off this episode, could you please give us 3 takeaways that you want parents to leave this episode knowing?
I think my first takeaway would be, you know, as a parent, be responsive. So watch your baby, don't watch the calendar, look out for those signs of readiness. And this, you know, starts from, you know, initially starting solids through the whole process until babies are 1. We don't want to be pressuring babies to consume full meals. We want them to, we just want to be responding to their cues. I think the second takeaway would be introducing the allergens. So really making sure that you're, I guess, prioritizing those allergens and getting them introduced before 12 months. And my last takeaway would be, you know, just to have fun with the process, enjoy it, and get messy and encourage mess.
Love it. Thank you so much for coming on.
Thank you.
It was lovely to have you here. Thanks for listening to Kids Health Explained, a podcast created by the Sydney Children's Hospitals Network and hosted by me, Sophie Delezio. This season, we're covering some need-to-know kids' health issues, including when to go to the emergency department versus the GP, and also answer some of your most pressing questions about vaccinations. So check out our feed on whatever platform you're getting us from. To stay up to date episode releases, please subscribe and follow Kids Health Explained. Finally, please leave us a review, and why not tell a friend or a relative about the show too? Thanks. Bye.